All right, we're moving on to our next slide, which is going to be meniscal injuries. I have Dr. Moheimani, my sister, on the line. Go ahead, doctor.
So we're going to talk about what the meniscus is and what the injury is. So in the previous talk, we kind of discussed what the role of the meniscus is, and it kind of serves as the buffer that helps you with the loading force that you put on your knee. As you can imagine, the knee joint is kind of small and it supports your entire body, so you need some sort of cushioning, and it's compressible. The reason you get meniscal injuries, though, is because it's taking a lot of force, and then it doesn't have the greatest blood supply in the world, so that makes it kind of more prone to long-term injury. The picture next to the text here is just showing the kind of different kind of tears you can have from the meniscus. So you'll hear words, when you read your radiology report, like a degenerative tear, horizontal tear, oblique tear. The extent of this injury in terms of how much symptoms you have, it's not 100% like if you have this, you're for sure going to have this many weeks off. Some people even have these tears and not even know about it.
So, but wouldn't you feel pain? I mean, if you have these kind of stuff, isn't there at least some pain associated with it?
Yeah, it's really interesting. So sometimes what is read on radiology imaging is not always diagnostic to what you have. We'll have patients that will get an MRI on them, and incidentally, they'll have these like tears in their meniscus, but that's not really what they're complaining of. They're complaining of something else. So that's why it's really important to see your doctor and to discuss with them kind of the findings. And there's a reason why there's a specialty for this, because it's actually not that straightforward, unfortunately. But if you're having knee injury and your doctor suspects a meniscal injury and you see a tear, then you can feel pretty confident that that's probably what's going on.
Okay. Can you bring up any famous athletes or something that the audience can kind of relate to when it comes to meniscal?
Again, so we said Ron Artest, Meta World Peace, Russell Westbrook, and then we're going to talk about Lonzo Ball as well, having a meniscus tear. So these are just some basic basketball players that can come to mind for the meniscal injury.
And if the audience doesn't know, my sister is a UCLA resident and a UCLA fan, which I don't approve of because I am a USC grad. Do you want me to go ahead and go to the next slide, or?
Yeah, let's go ahead.
Okay, so we'll move on to the next slide. Okay, so mechanisms of injury, go ahead.
So with the meniscus, there's two typical injuries that we see. One is a twisting one that happens, and you have the sudden injury. This is like the athlete injury. The other one is that patients have degenerative meniscal wear and tear. So that's kind of like what I was saying earlier, that sometimes you'll do an MRI and you'll see old tears that they basically maybe had given the patient some knee pain in the past, but they didn't really think much of it. So it's more of a degenerative process. So if you have locking or instability, you really should consider orthopedic surgery referral. The surgeons are great, especially if the knee is kind of giving out. That's when we think about doing surgery. Otherwise, studies have shown that even if you have a tear in your meniscus, surgery doesn't necessarily benefit unless you're a very young and healthy athlete. Surgery doesn't necessarily lead to better outcomes in the long term. So that's why I've mentioned PM&R, which is physical medicine and rehabilitation, which are the doctors that specialize in non-surgical approaches to musculoskeletal pain.
And that's what your specialty is. And so
Yeah.
if you, let's just say I was now 60, because I guess at 30, I would still be a good candidate for surgery, or is that too old?
Well, so being a surgical candidate for the meniscus, usually you see younger 20s to 30s is the age that you really see people operating on. Again, with the caveat that usually if you have instability and locking, like your knee is just unstable because there's a huge chunk of meniscus kind of flopping around and disrupting your knee joint, then surgery is definitely prompted. The one thing you will see, though, is that if there's no actual catching or popping, if you're not a real athlete, you're not out there playing for the NBA, usually conservative management just makes way more sense based off the evidence of literature that has come out showing that physical therapy and surgery are very similar in their outcomes for people who have degenerative long-term wear and tear on their knee.
So basically, I should consider doing, and let's just say I'm older. Let's say I'm a 50-year-old. I should highly consider doing rehab or PRP injections, something non-invasive, correct? I should try to avoid surgery when it comes to my meniscus?
Absolutely. And you'll see that in the academic centers where research really plays a huge role into deciding whether or not to operate on a patient, that there is much more of a push towards that than to operate.
So isn't there a conflict of interest? And I don't want to get you in trouble or anything, but if you go to an ortho is going to make a lot of money getting that surgery. So, I mean, if you do go to an ortho, aren't they going to just push for the surgery anyway?
So most people go into medicine for the right reasons, and hopefully it's not for financial interest. That's why it's always good.
What about the ones with 400 grand of student loans?
Whenever you do decide with surgery, it may not hurt to get a second opinion. Again, if you're at an institution that doesn't necessarily there's no financial incentive, then you may be a little bit more shielded from that.
And I hate to bring this up to you, but people really use Yelp. What is your opinion on Yelp? Or because people keep telling me that, hey, I go and pick my doctor off of the Yelp reviews.
I mean, I would use caution. I think Yelp is great for bedside manner. It's always good to pick a physician with good bedside manner, but sometimes a good doctor doesn't always tell you what you want to hear. It's kind of much like a parent-child relationship. So if they have a good Yelp review, it may be because they're only going along with what patients want, and that can also be bad in its own way.
So if I'm not using Yelp, what else would you recommend? What would be a better way? If I don't want to use Yelp, how would you recommend finding a good doctor? Is there any secrets?
That's really hard to say. It kind of depends on your insurance, but I think if someone
second opinion, right? You said the best way to figure this out is maybe see more than one doctor instead of just...
Yeah, second opinions are always good, and word of mouth, if you hear of an honest, good doctor, then, consider the extra wait time to see.
What about doctors on YouTube? No? Okay, well, anyways, so we hit the 7-minute mark. Are we done with this slide? Because we could start a new video.
Yeah, we're done.
Okay, so we'll start a new video with the next slide. So thank you very much, guys, for watching. We'll make a part 3.